Go ahead and hit record. No,
Not join until you start the webinar. I think that you can leave it in the practice session and ideally until the candidates are there. And then when,
so that's what I was asking. We can let them in now, even though it says you're in a practice session.
Yes, only panelists. Attendees can't come in, but panelists can. And each of them have their own thingy. So we can wait and hopefully they'll come in around 6:30, 6:35.
Okay, Tonya, I have one question that one of the ladies brought to my attention. How do I turn off the chat? Or how do you turn off the chat?
I
don't see a chat, but I see a question and answer. Oh, I see chat right there.
Mm-hmm. Let's see.
What are the 3 bars? I'll turn it off. My God, was that the dog? That was a bizarre sound. Okay, and the right, when I hit participants, I'm sorry, I'm eating pizza. Chat box, you can hit the 3 dots and it says attendees can tap with, and I'm going to click no one.
So well, do we want this
chat with the host and panelist?
Yeah.
No,
do we want it set on speaker view or gallery view?
I recommend to people, they get to choose that, but I always leave it on speaker view. Follow host view. Oh, good. Speaker view. That'll be the way it will be for them too. So
the way I'm looking at it now. Okay. And this is set up so are we going to do the question and answer box, Tonya? If we have time, or just try to.
We have not taken audience questions in the past ones. Okay. I think it's it can just be a very unpredictable things, and we want all of our candidates to feel very confident that they know what to expect. And we do encourage in our remarks that folks can reach out to candidates' offices themselves and to their websites and learn more and that sort of thing. So yeah, no, we'll keep it pretty scripted.
Okay. All right.
And if y'all want, I mean, we've got 15 minutes. It's up to you. If you want to just sort of everybody go dark or just sit and do whatever it is you need to do until right at time. And then Kim, you would hit start webinar, and that's how the attendees come in. But notice on your screen, Kim, if you hit participants, you can see if there are attendees in the waiting room. And at this time, there's not.
Right. I've got it.
Yeah, I just want to make sure you can see that. Yeah. Okay.
And so Kim, I'll probably go dark, and I'll keep an eye out on that so that you can just focus on your questions and what's being said if you would like.
Okay.
I can help let people in.
Yeah, do that, and then I'll just do whatever. So if you guys want to turn your cameras off, or you want to stay where you are and you want to work a little bit or whatever, and you'll hear me talk, and then we'll open it up right at 6:45. I just want to make sure y'all don't have any questions, and we wanted to make sure that we could hear you, we could see you. So, and then like I said, once candidate Levy gets in, we'll do the same with her, and then we'll get started right on time.
Okay, so you can hear me okay? Everything's good?
Yep, I can hear you fine, buddy. I can hear you fine. I can see you all both fine. So.
All right, very good. Okay,
all right.
Thanks.
So we'll see you in about 10 minutes. All right.
Okay, thanks.
I would go dark, but if I go dark, there are going to be 3 Tonya Millings up there. Y'all aren't listening.
I am. I was moving around.
I was just thinking, no, it's fine. It's fine. Y'all go do what you're gonna do. I'm gonna answer some emails and I'm gonna turn my mute on.
So Kim, if you want me to, why don't I sign out? Because I'm signed in under Tonya. You want me to sign out and sign in with myself so you don't have Tonya's picture up there twice? Uh-oh.
You don't have to go dark unless you want to.
Yeah, keep your camera on and you'll stay Robin.
Oh,
and that way, if I pass out or fall out or do something, you can just step right in and have that doctor.
Oh. Oh my.
Okay. So Tonya, when you having us over for dinner?
Right, I know it'll take a little time for unpacking, but And our, you know how delays, there've been so many delays with deliveries and such. Our furniture, we wanted a new living room set for the new place, and it doesn't come until early November or late October. So
Oh,
we
you
got a
can't
couple
get,
of bean bags that we're sitting on in the living room.
you can't get anything right now.
No, it's really hard right now. It's awful. I'm just hopeful that it stays on schedule. We'll see.
Yep. Okay, I think,
Oh, good. One more Tonya. That must be Lucy.
oh, I was,
Are you
Hi,
looking for
I'm
something?
Hannah Jane. I'm the intern. I'm just quickly turning the chat off for y'all.
oh, okay, great.
Thank you, Hannah Jane.
Thank you so much for doing that, Hannah Jane. I appreciate it.
No problem. All right, it's good to go now. So the participants will just be asking the questions in the Q&A if y'all have time for that, or any questions they may have.
All right, that sounds good. Thank you.
Y'all have a good night. Bye.
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 Thank you.
All right, Kim, I'm gonna go get something to drink. I'll be back in a few.
Okay.
All right.
Okay, Kim, I would say, candidate Levy, we can go right up. I was wrong. The attendees don't show until they're let in. It's different than the
Oh, okay,
meeting.
so she may be on one of those. So I
And,
should-
I mean, if she didn't use the right thingy, it's possible. So if you want to
Start
start webinar and then tell everyone, welcome and we'll get started on time at 6:45. But then Robin, you check the attendee list, and if she's on there, promote her to panelist. Does that
Okay,
make sense?
I'm gonna go ahead and start it now. So guys, just to let you know that when I started, people will be seeing you on the screen, okay? As we let them in. So if you want to turn your camera off, candidate Scott, you can, or you can just stay on the screen. Either way, they're just going to be able to see you now once we start letting people in, even though we haven't really actually started. There you go. All right, I'm starting it. We want to welcome everyone this evening. We should get started right on time, and just hold tight and we'll get with you in just a minute.
And Kim, I checked my email. I don't have anything from candidate Levy, so I don't know if something came up. We will just proceed without her. But I did want you to know I took a look to see if I could find out anything, but.
Right. Well, everyone, we've got about 4 minutes before we get started. I take that back. It's 6:45. My computer is off. Oh, there she is. Welcome, candidate Levy. We are in webinar mode, so even though you don't see people, they do see you. So welcome. So we're going to go ahead and get started. Like I said, my computer clock is off a little bit. So I want to thank everyone for joining us for this virtual candidate forum. for those of you who haven't met me, my name is Kim Goodloe, and I serve as the board president for the ARC of Virginia, and I am a local member of the ARC of Hanover. I want everyone to know that we are recording this webinar, and hopefully the ARC of Hanover will be able to put it up on their Facebook page and their other social media pages for people to see. We're very excited to have with us tonight candidates for the 55th and the 97th districts. Just as a reminder, the ARC of Virginia and its chapters, including the ARC of Hanover, are nonpartisan 501c3 organizations, and we do not endorse political parties or candidates. Tonight's event is not a debate. Rather, it is an opportunity for each candidate to introduce themselves and share their personal ideas about and responses to questions that are important to Virginians with developmental disabilities, their families, their caregivers, and their communities. We're going to give each candidate joining us tonight the opportunity to briefly introduce themselves and offer a little bit about their background. And we're going to take them up alphabetically by district. So we're going to start with Delegate Fowler. Delegate Fowler, if you'd like to introduce yourself and say a few words.
Right, sure. I am, my name is, of course, Buddy Fowler. I've been representing the 55th House District for almost 8 years now. Again, I have, more importantly, I've been a member of Hanover ARC, I'd say now for probably about 30 years. And with the tutelage of Lucy Cantrell, and of course, I think Kim Goodloe as well, they have brought me along and taught me a whole lot about the challenges that we are having with the ID and DD waiver program, as well as other things. And I greatly appreciate that. Again, the waiver program has always been a priority for me. I've always ensured and many times offered the budget amendments or co-patron the budget amendments to increase the funding for the ID and DD waiver programs. I think, again, taking care of folks that can't care for themselves should be a priority. And I'm glad to, I've always just been a part of that. And again, I've also, in the last 2 years, I've been appointed to, the speaker put me on the Health, Welfare, and Institutions Committee. So now finally, I think I can also be able to take a little bit more of a legislative role with respect to mental health services and other things. So again, I look forward to the discussion tonight and appreciate the opportunity to be here. Thank you. Thank you, Kim.
Thank you, Delegate Fowler. Candidate Levy, we'll go to you.
All right, good evening, everyone. My name is Rachel Levy. I'm running for the Virginia House of Delegates in the 55th District. I am a public school teacher. I'm a mother of 3. I have a PhD in educational leadership and policy, and I'm known as a community leader. I will say, as a public school teacher, I've had a decade plus years of teaching experience, and I've taught mostly middle school and high school, but I've also taught, I've adjuncted at the higher ed level. I've taught preschool. I've worked with elementary school students. I've taught adults. And I value having students of all abilities in my classes. I'm dual certified in social studies and English for speakers of other languages. And while having more than one language is a gift and not a disability, I have helped students and families navigate a public school system that is not always designed to accommodate them well. And it's been eye-opening. And I think through that experience and through the experience of also teaching students with disabilities, it's opened my eyes to how we're strong in our public democratic institutions that serve the public and how we can better. The other thing is that I have a child with a medical disability with type 1 diabetes, and I have navigated the 504 process as a parent, and I've also navigated our healthcare system, and I help to advocate for the $50 cap on prescription insulin. And this experience, I didn't know much about medical disabilities or type 1 diabetes before my own child had it. And it's really opened my eyes that we can't just care about things that immediately impact us, we have to have a sense of responsibility for all people, all members of our community, no matter who they are or what abilities they have.
Thank you. Now we'll go to candidate Scott.
Good evening, everybody. Thanks, Kim. Thanks to the Arc of Hanover for holding this event. I'm really very happy to be here this evening for this discussion. It's a very important one, and it's important because we're talking about an underserved community here, and we need to work together to figure out better ways to support the people with disabilities and their families. I spent 20 years in the Army as a combat soldier. After I retired in 2002, I started mostly doing program management type work for defense contractors and other government contractor type companies. A lot of this was in the realm of installation operations and public safety. So my background is in forging teams that can execute plans and make things happen. So my expertise is in finding ways to both find the funding and then help execute plans that help people or teach people. I think that well, one of the questions you've asked here in the agenda and the sheet I've got asks about my background in this space. And I think the closest I come here is soldiers' families. A lot of soldiers' families have children that face these issues. And one of the things I learned in my military service is that we have to, in order to make everyone productive, we have to support families and we have to support their children and give them opportunities so the families can also be productive and do what they need to do. So I'm looking forward to this discussion. I think I'll just add real quick that in my mind, the key thing we need to learn to do is listen to the experts. And then often those are the people who have these issues in the first place and organizations like the Arc of Hanover that work so hard to help them out. So I'm happy to be here tonight. Thanks.
Thank all of you for that. So we're going to go ahead and get started with the questions. Let's see here. And again, we're going to go alphabetically and then we'll switch so everyone will have an opportunity to answer a question first. So question number 1. Virginia has a waiting list of more than 13,000 people, 3,000 of whom are in urgent need or are referred to as priority 1 for Medicaid DD waivers. These waivers fund home and community services that help people with developmental disabilities to live fully included in their community. How would you help ensure our General Assembly makes ending this wait a priority so no one with a developmental disability is waiting for essential services? And we'll start with Delegate Fowler.
Okay, thank you, Kim. Well, first of all, again, this has always been a priority for myself. But again, in the General Assembly, the budget, has lots of priorities. So let me just tell you, kind of where we are at the moment. This past year, we've had a budget amendment which created an additional 435 slots, IDDD slots, which brought our total up through fiscal year 2022 up to about, I think it's 985 slots. So that's the total amount of slots that we have available now, at least in the upcoming budget. Another challenge that we have is, well, first of all, we need to be able to provide the services that we have for the ID and DD waiver recipients. And of course, one of the challenges has been the caregivers in that regard. And one of the things the General Assembly did this year was increase the funding for pay and things like that to provide for those services. Now, again, I'm a little bit concerned. Well, again, while that was a step in the right direction, if you look at the hourly wage, which I think are going to be bumped up to about $11 per hour, that's still far below, I think, what the market requires. I think in Hanover County, probably the lowest wage or might be somewhere between $15 or $20 an hour. So again, I don't think that's sufficient. We need to put more money there. The other thing I think which really worked well during the COVID was the telehealth services. Now, again, the Washington, the federal government granted a waiver because of COVID, so we could have those telehealth services for the ID/DD waiver folks. And so we've got language in the budget which will require, it requires the state to request a waiver so we can continue those telehealth services. So again, I think the ideas like that, we get more bang for the buck and we can provide more services for people. So again, unfortunately, the ball is going to be in the court, up in Washington, D.C. So hopefully those those things will be, first of all, it's the pay increases and the telehealth services. We need to have that okayed by Washington, D.C. so we can do that at the state level. So I think that gets us in the right direction. And second of all, we just need to make a priority. Again, there's a lot of priorities down there. For instance, I was not a big fan and didn't support the expansion of Medicaid, which now I think we're at approximately about 600 individuals in that program, 600,000, which we're talking about mostly able-bodied males. And so again, and I believe that's siphoning away money from these folks that need, the ID and DD waiver program. So again, that was a legislative choice that the state made. I was opposed to it, and I was in the minority on that issue. But again, this is going to take money, and like I say, this is a priority for me, and it will always be a priority for me. So thank you.
Thank you, buddy.
Yeah.
Candidate Levy.
Yes. So I have two thoughts about ending this waiting list. And the first is we have to expand access to Medicaid, but we must also expand capacity because we have a staffing shortage right now, like in so many fields. And so we have to make incremental progress. We have to build pipelines for training and educating and recruiting and retaining providers. And then if we're paying more, then if we need to fund Medicaid services more. And I don't think the answer is to pit vulnerable population against vulnerable population. I think we can serve everybody who needs services in healthcare. And then second of all, as far as I understand, services for people with developmental disabilities are not covered by private insurance funding at all. Could we look into changing that? Expansion of services that would be for thousands of people covered under private insurance. And one thing to really look at is developmental disability and mental health and behavioral health services parity with medical and health services parity. We don't have that with private insurance right now. So those are my two thoughts on how to make progress towards ending the waiting list.
Thank you. Candidate Scott.
Thanks, Kim. This has been an ongoing issue, and it's time to fix it. I think, to me, the core answer here is simply to make sure every Virginian has access to quality health care, not just health insurance or Medicaid, but quality health care. And these priorities, the folks on this waiting list, in large part, this can be considered health care. We need to take care of people, whether they're able-bodied and working or not. And so I have to say, I'm just in favor of making sure we expand Medicaid, we pass a Medicare for all bill, or create a public option under Obamacare in Virginia. But to me, the core answer is we just have to think about this in terms of healthcare and in terms of the staff as healthcare workers, and expand healthcare to cover everyone. With respect to Medicaid, I think we need to increase the Medicaid reimbursement rate so more physicians and other healthcare providers will accept Medicaid as a payment option, and that would unleash some of the sort of resources that are underused, I think. But that's my core thinking on this, is that I don't think we need to separate these folks into, like Rachel said, you know, vulnerable community versus vulnerable community. Let's just make sure everybody has health care. Let's think of this as health care and make sure everyone has the services they need, whatever they are. Thanks.
Thank you. For our next question, we're going to start with, sorry, I'm skipping down. We're going to start with candidate Levy and then go to candidate Scott and then delegate Fowler. So for question number 2, about 3% of the population has a developmental disability. In Virginia, that equates to just over 250,000 people, not to mention family members who are directly affected by a loved one's disability. What do you think the role of a delegate should be in supporting people with developmental disabilities and their families? And we're going to start with you, candidate Levy.
So people with developmental disabilities are an overlooked population. And so what you have to do when you're thinking about that is you have to be deliberate in thinking about them in every decision you make. So you look at every sector, every policy area, and you think about, how am I including people with developmental disabilities? How am I making sure that they are being helped and not harmed by these policies that are being passed? And this is especially true, of course, with healthcare, education, and social services. But it also goes back to what I said in my opening statement, that this means seeing people with developmental disabilities as all of our responsibility, you know, as a delegate, as a community, as a district, as a Commonwealth. And that also means taking care and thinking about their caretakers and their families. Because I know, like I said, I have a child with type 1 diabetes, and we spend an enormous amount of time helping him manage his condition. And when people with developmental disabilities' lives are better, when their families' lives are better, then they're more productive, and all of our lives are better. And so we have to look at it as a collective good, that when vulnerable people are helped, then all of us are stronger.
Thank you. Candidate Scott.
Well, thanks, Kim. What do you think the role of the delegate should be? Well, first of all, provide the funding. Let's just legislate the funding and get it in the budget bill. This is easy. Virginia's a wealthy state. We can afford it. This kind of funding also might have some economic development implications, both in terms of training people with developmental disabilities to do certain jobs that might also attract businesses, but also providing these kinds of services might help us attract some larger corporations whose senior staff have children in these situations. And this would make Virginia an attractive state to bring some of these corporations here. But a delegate can also do a couple of other things. First of all, like I said before, listen to experts. Delegates can be an advocate. If I'm elected, I will have a platform I can use to talk about this, to raise money for this, and to provide policy support after listening to experts and understanding what the real need is, so we can direct the funding and the policy support in the right direction. So I think there's several things we can do, both actual action we can take with respect to funding and think about the economic development implications, but also just as an advocate, listen to experts and let folks know that this is an issue we need to fix because this is an underserved population. Thank you.
Thank you. Delegate Fowler.
Yeah, thank you, Kim. Yeah, first of all, you know, I think the role of a delegate, first of all, is to engage. You need to listen, and then ultimately you need to be an advocate for, you know, for all kinds of different things. And again, one of the things that has been a priority for me from day one has been the ID and the DD waiver program. So again, and like I say now, as a member of the Health, Welfare, and Institutions, I think I'm committee, I'm in a little bit better position to make some of these policies come to fruition. And so again, and of course, a couple of the people that I used to listen to a lot is of course Lucy and others in Hanover ARC, who really brought me along to I understood a lot of the challenges and things facing this community. And again, I feel like in a lot of ways I'm a part of this community. But finally, before I stop, I want to just make sure that people understand that I believe the statement was made about looking at private insurance for offering some services. Now, in the Commonwealth of Virginia has passed a law. I think it's been probably 10 years ago, and it's been added to ever since. But private insurance in Virginia now has to provide services for families with autistic children. I mean, so that's already the law. Now, how many folks take advantage of that, I couldn't tell you, but again, that's already the law in the Commonwealth of Virginia. So again, thank you, Kim.
Thank you.
Mhm.
We're going to move on to question number 3. And candidate Scott, you'll go first, delegate Fowler second, and then candidate Levy will go last. A large number, and I think some of you have touched on this a little bit, but a large number of Virginians with developmental disabilities rely on a direct service professional for at least some level of daily support. Current reimbursement rates for Medicaid waiver services are structured to yield an average annual salary of under $23,000, which has contributed to high turnover rates in this critical field. Instability for already vulnerable families and a lack of financial security for direct support professionals. How can the Commonwealth address this issue in the upcoming session and help provide some stability to both waiver recipients and their caregivers? And we'll start with you, candidate Scott.
Well, these direct service professionals aren't the only folks in Virginia who don't have a living wage. So first, we really need to raise wages across the board. Since the early 70s, American worker productivity has increased 236%. Worker wages have gone up 15%. The market's not fixing this. So we need to mandate, first of all, a living wage. So we need to slowly raise the minimum wage for every worker in Virginia. Okay, this would mean raising the reimbursement rates for these professionals. But again, this is really all about where we're spending our money. And this is a place where we ought to be spending money to make sure that these folks get the services they need, that the DSPs have a living wage so that they want to keep these jobs, and to sort of liberate families and folks with disabilities so they can live productive, high quality lives despite the situation they find themselves in. This is a general problem across the board. Again, Virginia is a very wealthy state, and we can make Virginia a more attractive place for people to live and work and start businesses by making sure everyone has a living wage. And by the way, if poorer people, both DSPs and other Virginians, if they have more money, they will spend it. They will spend it. If you cut taxes for wealthy people, they won't spend it, or they won't spend it here. If you cut taxes if you raise wages for poorer people, including these DSPs, they will spend the money getting their car fixed and support businesses in the local area. So I think we need to think more broadly here, and not just about DSPs, but we have to make sure that we have high quality professionals doing this job, supporting these families, and that means paying them more, even if it costs the Commonwealth a little bit more money. Thanks.
Thank you. I'm sorry, candidate Levy.
Okay, so first of all, we have to raise the reimbursement rates, right? If we're going to pay, if the providers have to pay their employees more, then they also need their reimbursement rates to go up so that they can stay in business. Second, we have to build better pipelines for people to go into these professions, and we have to professionalize them. They are professions. The people that I hear from and that I talk to, they love the work. They love the work. They love to work with the people, but they want to be compensated, and they should be compensated fairly. And it's like that. I'm a public school teacher. It's like that in my profession. People, there's not a teacher shortage. There's a working condition and a compensation problem. There's so many people who want to be teachers. There's so many people who want to work with people and provide services with developmental disabilities, but we can't keep them if they're not being compensated fairly, if they don't have good working conditions, because they do really valuable work. This is skilled labor. This is very valuable work, and they have to be compensated accordingly. But again, we have to, we can't just put that all on the providers themselves. They have to be able to pay their bills and keep the lights on as well.
Thank you for that. So question 4, and we're going to start with Delegate Fowler and then go to candidate Levy and then to candidate Scott. A recent study in Virginia shows that a large number of students with developmental disabilities would like or were not able to receive appropriate supports in their local public schools, in large part because of services funding that remains almost exclusively accessible only to students who are placed in outside, less integrated private day schools. Local divisions and advocates have been working for several years to provide choice to students and families in the educational placement that works best for each student. How do you think Virginia can better support schools and students to provide and fund the necessary services they need in their least restrictive environment, wherever that may be? Delegate Fowler, we'll start with you.
All right, just gonna back up just a second, Kim. I don't think I'm this forgetful, but I don't believe I had an opportunity to answer question number 3.
Oh, I apologize sincerely.
No, it's no problem, because it's going to kind of be like a broken record. But so if it's okay with you, I'll just answer both of those. Is that okay?
No, absolutely. I apologize. Do you want me to reread? Well, let me reread the question so people know what you're answering.
Okay.
So the question is, how can the Commonwealth address this issue? Well, I have to read the whole thing. It's basically about pay and direct support people, and how can the Commonwealth address the issue in the upcoming session and help provide stability to both waiver recipients and their caregivers?
Well, again, just like my colleagues on this call here, the answer is about money. Okay, so let me just tell you where we are. In the last session, we've appropriated about $130 million, for pay increases. Of course, that at the end of the day, and this is like the 22 to 24 biennium, that only gets the rate up to $11 an hour. And I got to tell you, that's not going to cut it. We really need to get more money in there. And, I would say at least get it to like $15 an hour to get enough people and the quality people to do this job, because it's an important job. But clearly, I mean, I talk to employers all the time with what they're paying to get good people, in their businesses. And I mean, it's hard. It's impossible to get people for $11 an hour. It may depend on where you live, but you can't get them around here for that. So again, we really need to increase that. And number 3. And then again, another thing, again, we got to go to get a waiver to do it. But again, telehealth services is also another way where we can expand the coverage of these workers. And again, that doesn't work for everybody, but it does work for a lot of people. And I've heard from a lot of people with IDD waiver program that really benefited from the telehealth. So again, that's another thing that we need to exploit for the folks with ID and DD waiver programs. Now, again, getting to question 4, how do you think we better support schools? Well, I think one of the things we need is to give with the schools, and because again, there's so many of these other private schools that offer these services. So I think what we really need to do to expand the opportunities and increase access is we need to give parents more choice and where they would decide they want a type of program that works best for their child, for the ID and the DD program. So, and I think that's one thing that we need to do. So, and I'll just leave it at that.
Thank you. And I am going to reread the question just for people watching, but a recent study in Virginia shows that a large number of students with developmental disabilities would like, but are not able to receive appropriate supports in their local public schools, in large part because of services funding that remain almost exclusively accessible only to students who are placed in outside, less integrated private day schools. Local divisions and advocates have been working for several years to provide choice to students and families in the educational placement that works best for each student. How do you think Virginia can better support schools and students to provide and fund the necessary services they need in their least restrictive environment, wherever that may be? And it'll be candidate Levy, I'm sorry.
All right, so I have a few thoughts on this. First of all, if you're talking local services, again, from what my understanding is from the people in the field who have talked about this, every community services board, every CSB operates independently. And so what I've heard is needed in part is some consistency in terms of making DD services more consistent across the board. And then second of all, yes, we need to have more coordination with schools for these services. I mean, the students are at the schools. It's convenient. It makes sense to serve the students in the schools. But to do that, we can't just mandate the services in the school. We can't just layer the services on educators. We actually have to have people who are specially trained and licensed to provide these services. And we need infrastructure, we need school facilities and tools and resources that will enable the services to be provided. So those are all important keys to this. Now, in some cases, and I've followed along with this closely, both in Virginia and just in my studies of education policy, in some cases, I know the private placement is preferable or better, and families, sometimes families have to really fight for those when they prefer those. I've also seen in public schools successful settings where they have centers where they specialize in certain services. But the downside to that is then you can have students who are not served in their districted or community schools, and they want to be with their neighbors or with the kids across the street. And so we have to be careful. We have to balance like not segregating a certain population into one school in a school district. And then going back, that brings us back to the infrastructure piece, which is we need to design schools with universal design in place. We need to, and going back to one of your previous questions about, how do you serve people as a delegate? Yes, you consult with the community, with the people most impacted, families and people with developmental disabilities, and then people who have expertise, and you build infrastructure that will be inclusive of those students. And I think you could say that about so many populations in Virginia. So when we replace and renovate our school buildings that are way overdue, this is something that we need to address very deliberately and purposefully, is serving students with developmental disabilities.
Thank you. Candidate Scott?
I'm no expert on this, and I think I would echo a lot of the things that Dr. Levy said, but I think that as a general matter, we need to think about the way we fund our schools, generally speaking. I think we need to think about community needs and not as much property values. This is a tough nut to crack because you might have a community where there are some folks with disabilities who want to attend the local school with their neighbors, like Dr. Levy mentioned, but there's only a few. And now we want to be careful not to put mandates on local school systems that we're not funding. At the end of the day, again, this comes back to money. And the Commonwealth has to fund the local schools in ways that provide the public education to every Virginian that the Constitution requires. Virginia Constitution requires a public education to every student, every Virginian. And we need to pay for that. We need to make sure we're funding that. What that looks like in Botetourt County will be different than what it looks like in Fairfax County or Hanover County or New Kent or King William. So I think we need to listen to local experts, local school boards, local experts like Dr. Levy. We need to listen to local experts like the Arc of Hanover, and sort of connect the local folks with the community needs and with the funding from the Commonwealth. This is hard. That means we need to listen to the local experts who can tell us what the best way to do this is. And if I'm elected, I'll promise to do that.
Thank you. We're going to move on to question 5, and this time candidate Scott will start, and then candidate Delegate Fowler, and then candidate Levy. I may be messing up these orders. I apologize.
You're doing
Did
great.
Delegate Fowler get answer that question?
I'm sorry.
Yeah, he did.
Okay, right, so-
You're doing fine, Kim, and I don't think any of the three of us really mind so much.
Okay, so
We're
question
having
5.
a good discussion here, and I think that's what matters.
The General Assembly has made great advancements in the past 5 years to fund housing subsidies set aside for people with developmental disabilities. The result has been an increase in people living independently with supports and having happier lives. However, that can only be sustained with ongoing state funds, as many people with developmental disabilities have a monthly income of just $791 from Social Security benefits. How do we ensure we keep fully integrated affordable housing accessible? And we'll start with you, candidate Scott.
Well, we actually have, I keep saying this over and over again. We're here to talk about a particular community, a particular group of folks. But some of these issues are faced by other people in the 97th and the 55th. We have a housing issue as a general matter in the 97th. There are folks in the in the 97th district who still don't have indoor plumbing in their homes. So we need to figure out ways to make sure everyone has a serviceable place to live with indoor plumbing that's affordable for them. Part of this means more housing. Part of this means funding. I'm not sure how anyone survives on $791 a month, whether they're disabled or not. So we have to think about ways to do this. Some of it can be done by private organizations like Habitat for Humanity. Some of it needs to be done with housing subsidies that come from the state. But I think what we really ought to think about doing is maybe we can figure out how to solve this problem, this whole series of problems for this underserved community by making sure that every one of them has an adequate livable income, right? And that the people who provide their services have a living wage, so we can make sure that they're able to purchase or access the services and housing they need. We spend too much time in Virginia and in the United States generally thinking about the way we live being connected to how much money we make. If you make a lot of money, you get to live in a nice big house, and you get to drive nice cars, and you get to have health care. And too many of these things we have to live, food, clothing, shelter, health care, are rationed by how much money we make. And we need to think about our moral obligations to the people we live with in our community who cannot help themselves or who need assistance helping themselves, because none of these folks are backing off of trying to do the best they can. And we need to be there to support them when it comes to all of these sort of aspects of quality of life. We need to help our fellow community members, both with and without disabilities, and that means funding. We have to share, just like we were taught in kindergarten. Thanks.
I'm going to move to candidate Levy.
So yeah, I agree with Mr. Scott about we do have a housing affordability and availability crisis throughout the 55th district, and I guess the 97th district as well. And this is not just, and in the area across the Commonwealth. And this isn't just an issue facing people with developmental disabilities. But I think, yes, people want to live as independently as possible. And we need to help make that happen. So yes, we need to set aside more funding for housing, but there's always the tension, like, do you subsidize the housing, or do you make sure that people make enough to afford housing on the market as it is? You know, I face this as a teacher. They're now offering Habitat for Humanity housing for teachers. But teachers, should make enough that they don't qualify for Habitat for Humanity. But in the short term, if they don't, how do we help them? And so that's the kind of chicken and the egg thing that we need to think about. Some suggestions I have for this is just like when you have new housing developments, or you have, say, development or industrial places, malls being repurposed, and you set aside a certain amount of housing for people with certain incomes, we should do the same for people with developmental disabilities. And everybody, I volunteered in this type of housing when I was a child through my synagogue, and they're good neighbors. People love, and they're stable neighbors, and they stay, and they're good community members. And so I think people want to have them as neighbors. So we should put aside housing. This can be done through zoning. It can be done through agreements with our local governments. We should set aside, have some requirements where a certain number of units are set aside for people with developmental disabilities when there is new or repurposed housing.
Thank you. Delegate Fowler.
Yeah. Yes, Kim. I want to back up just one more second about the stuff with the schools. Here's the thing that nobody talks about, but I talk about with their school superintendent and others all the time. This is a partnership for the care for the ID and the DD waiver program. This is a partnership that we have with the federal government. And unfortunately, the federal government has never funded that program the way they were supposed to initially. So again, a lot of that falls back on the state and local government. And again, it's very expensive. So I just want to make sure everybody realizes that. Again, I agree with Dr. Levy about, I think this is, first of all, an area where we need to look at zoning and conditional use permits, and maybe in certain types of developments or any type of development, to have some consideration for the construction of these, these multiple use type buildings where, that aren't necessarily single family, but there's room for this, because again, these folks are great neighbors, and so we need to look at that. Again, depending on where you live, and unfortunately, a lot of places in the 55th district, land is very expensive, development is very expensive, and so you run into that. But that being said, though, I think with the right type of zoning and conditional use permits, we can make this happen. But that's really the biggest challenge. And again, this also costs money. But that's what we need to do, Kim. Thank you.
Thank you. Question 6, and we'll start with candidate Levy. I apologize. I've really messed these orders up. People with developmental disabilities are generally employed at much lower rates than the typical population. Despite a desire for meaningful paid employment, how can we promote employment of people with developmental disabilities in Virginia?
So yeah, we should absolutely be promoting employment among this population. Most people want to live independently. Most people want to work. Most people want to support themselves. I mean, now is the perfect time for this, right? We have labor shortages in a lot of places and in a lot of fields. And from what I know, people with developmental disabilities, they are loyal and good employees. They'll stay for a long time. My father worked for the federal government for almost his entire career, and there was a program where he worked, and the same people with developmental disabilities stayed in that office for years and years and years. And I think we could look at having some hiring requirements. We can look at having some job training in the schools for these students. I know in the high school where I teach, There's a special program for students with developmental disabilities where they run a coffee cart. Every Tuesday, we buy coffee, and they learn job skills. And then also, we should think about having a special agency or organization that can mentor these folks through their job. I think of my own campaign. I have been awarded a few fellows, and my campaign is responsible for providing X, Y, and Z, the experience, and we hired the fellows, but then there's an organization that provides training and mentorship and make sure that they are being treated fairly, and making sure they get what they need. We could have something like that, if we don't already, that will support people with developmental disabilities get employed and stay employed. And I think that would be a win-win situation for employers and for people who prefer to be employed.
Delegate Fowler.
Yes, thank you, Kim. This is, I run across people all around the district with special needs that have employment. And I think that's great. To the extent we can expand it, I think we should. I don't know, Kim, you may have some idea about how many folks are out there that are employed. And so anything we can do to increase that, I think we need to do. But I will say this, if we talk about, setting wages certain places and things like that, I'm concerned that may have a negative effect on hiring. So I would hate to go down that road, because I know that the folks that are in the waiver program, they really want to get out. And this is also therapeutic. It's a learning process to them. So anything that would have the possibility of reducing the number of folks that could have employment, I would be concerned about that. So I really do think we need to be careful there. But I think it's a great program, and we need to do all we can to to expand it. So thank you.
Candidate Scott.
Thank you, Kim. This is another very difficult sort of issue. I think part of it gets back to the schools, right? Mm-hmm. Part of it gets back to integrating this community, these folks into the school system, because a lot of this is a training question. And these folks might have very specific training needs that we need to try to address. And local school systems may or may not be equipped to manage that. So we may need to think about specific training programs. I think we also should think about ways to attract businesses that can employ these folks, right? When I do defense contracts, I work a lot with subcontractors because the federal acquisition regulations require that a certain percentage of many contracts go to businesses that employ folks with disabilities. So maybe in Virginia, we should be trying to attract these businesses to the Commonwealth, and that would help employ these folks. I think as a general matter, we want to try to integrate these folks into the community, and that starts when they're young, when they're in school, when they go through training programs. I think our union friends can help us with this, because they do a lot of apprenticeship stuff, and a lot of these folks might be able to integrate into some of these apprenticeship programs and be very successful. And they're well paid. These are not trivial wage jobs. Some of them are fairly high wage jobs, and I'm confident that a lot of folks in the disabled community could be very successful in these kinds of positions. So again, it's another place where we need to listen to the experts, because I think one thing we ought to do is convene conferences or groups of folks who want training, who want jobs, and so we can identify the skill sets and the training they need, and then get them integrated into the business community. We could also teach them some entrepreneurship and maybe connect some folks in the community together who have similar skill sets, and they can start their own businesses. And that would actually be ideal in many ways. So there's a few ideas I think we can throw around, but we would want to convene a group of experts and the folks who have this need who can explain to us what we really need to do in the General Assembly to make this work. Thanks.
No, thank you for that. We've got some extra time. So I just want to make it clear that the ARC of Virginia and ARC of Hanover will post a Facebook video that will have, this conversation that we've had. And then I guess in closing, first, I want to thank you all for being here. I know your time is very valuable. It's an election season. Everybody's busy holding down their jobs and their children, and COVID has put an impact on everything. But I would like to also offer the resource Buddy's mentioned before that, Lucy Cantrell and myself have, the ARC of Virginia, every local chapter of the ARC is probably one of the biggest voices for people with developmental disabilities between the ARC of the US, and then that filters down to each state, and then each state has their own chapters. And so, when you talk about experts and things like that, we just want you to know that we're here. Like, we want you to reach out to us. We want you to ask questions. We want you to, to get whatever information you feel like you need. Please reach out to us and we'll be happy to assist. We have a very strong grassroots, and, our families are very active, and we appreciate all the answers that we've gotten here tonight. I mean, they're good answers. I mean, if we could take everybody's answers and kind of melt them together, I think it would bring us to a very good place. So again, I want to thank you all. I know, that every delegate, every candidate can't know everything about every issue. So I just want to extend to you the expertise of the ARC of Virginia, and know that whatever questions you have or whatever things you'd like to learn about, please reach out to us. And again, thank you so much for being here tonight. And like I said, look for the Facebook post. We'll tag you in it. We just hope you all have a good evening. If you'd each like to take a minute and close, we'd love for you to do that. So if you have any closing words, we can start with you, Candidate Levy.
I just want to say thank you so much for having me. And the questions were really good questions, and they made me do my homework. And so I appreciate this whole process. I love to learn, and I love to learn about how I can serve the people of the 55th District and serve the people of the Commonwealth of Virginia to the best of my abilities. And so you are helping me do that. And thanks everybody for coming. And thank you, Delegate Fowler, for being here. And Candidate Scott, thank you for being here. I also learn a lot from your answers as well.
Delegate Fowler.
Again, I just want to echo what Dr. Levy and Stan said. Again, it was a great discussion. What Kim and them say is exactly right. They're really the subject matter experts, at least in Hanover County. And that is why, y'all have been on my speed dial for like ever. And so I really appreciate, your expertise. I think we're moving forward with respect to the ID and DD waivers and the services that we're providing. I think, the telehealth and other things, all these things are improvements on the status quo. But again, we have a lot more to do with respect to money, and I'm willing to do my part. And I thank you for the opportunity to be here with y'all tonight. So thank you, Kim. Appreciate it.
Thank you. And Candidates, Scott.
Thanks, Kim, and thanks to the ARC of Hanover for holding this forum. This has been a great discussion. I've learned a lot from you, Delegate Fowler, and from you, Dr. Levy, and I'm looking forward to learning more from the experts at the ARC on what these issues really are and what the best way to solve them is. Yeah. I would just close by saying thank you for doing this. Thanks for having me. And I'm looking to help create a universe where we don't think about folks with disabilities as different. Yeah. We don't need a different program. We don't need a special program for someone. Everyone's integrated. Everyone can try to live the life that they want to live, and their community, the community around them, supports all marginalized people, including this community. I think that's very important because we have a lot of challenges in Virginia and American society today, and we have to work together to solve them. This community, the disabled community, has a lot to offer as we look for those solutions. And I look forward to working toward that, that kind of society and that kind of place, that kind of Virginia. So again, thanks for having me. Thanks, Delegate Fowler. Thanks, Dr. Levy. Thank you, Kim, and to the Arc of Hanover. Really appreciate everything you guys do. Thank you.
Thank you all for being here this evening. I hope you enjoy the rest of your night, and have a good Halloween. Hopefully we might even see some kids trick-or-treating. So good night.
Thanks,
Happy
Kim.
Halloween.
See you
Good night,
later.
everyone.
Good night.
See everyone.
Take
Bye.
care.
Bye.
Good night.
All right, thanks again. I'm sorry I was late. I had an event right before this one. I don't know if Ashley told you, and they were supposed to ask me my question first, and they didn't. And so like I answered, and then I came on. So I'm sorry I was a few minutes late.
No problem. Thank you so much for being here.
Okay, take care.
Bye.